That's a great question. We actually work with our pharmacists, and our clinical pharmacists are in clinic at my site. And what they do is they work with our nurses, our nurse practitioners, advanced practitioners, and also our physicians doing telephone discharge, phone call follow-ups, so newly diagnosed patients coming out of the hospital addressing, did they get their medications? Are they on the right medications? Do they even know how to take the medications? And this pilot program, which is now expanding, has really addressed the critical need for adherence issues. You know, one of the things that we're finding out is even at the time of discharge, patients don't know what their medications are. And so they've already been through a horrific event. They got diagnosed with cancer, sometimes in the inpatient setting, and now someone tells them to take a pill, but they're on 10, 15 other supportive care pills as well. And when they get that prescription, sometimes they don't have that prescription there for them. So by doing or enacting adherence phone call follow-ups and discharge phone call follow-ups, we've actually been growing our patient understanding, but also increasing patient adherence. In addition, we also have data from our breast cancer area where we've also been doing adherence phone call follow-ups and actually monthly checkups with our patients as well. So really adding to the education piece, but looking forward to a lot of the new entities coming along with these oral therapies. I think the one thing right now where we're seeing a change is the combination utilization of both an intravenous or parenteral medication and the oral medication. So this provides a very different discussion piece because the patient is coming to the infusion center, getting there, for example, rituximab. Then they may be coming in and also receiving a prescription for an oral therapy like ibrutinib, in this case for CLL. That combination is two different types of administrations. So by working and looking at what's happening with these patients, we have to do a lot of education, address both components for how they're taking the medication, and also look at side effect profiles for the patients while on therapy. And we actually have a number of people on the OCM project. I'm just one in regards to that. And this has been a long-standing project through OCM pilot development. So one piece is, of course, looking at the education. Another area which has been really discussed for many years on those 10 pieces for the OCM is also looking at adherence and dose changes. You know, we're looking at side effect profiles, evaluating patients for the correct chemotherapy, making sure they're being mitigated for their disease control, and also side effect management to ensure adherence. So that's just one part of that puzzle as well. There's other areas which are also being developed as part of our team in which are looking at payments, evaluating the data, and also addressing cost-based valuations for the total cost of care in these populations as well. So my part is just one small part of that, looking at the overall piece for OCM. But the oral piece on that is a big discussion as we see time go on for current chemotherapies and also sequencing of therapies down the line.